management at the Gomoa Potsin Polyclinic located in the central region is pushing for an expansion of the current facility. Despite serving a community over 300,000, the clinic's bed capacity stands at a mere 13, leaving health workers concerned about the ability to handle mass medical emergencies. Central Regional Correspondent Calvi Sete brings us more in this report.
The Gomoa Potsin Polyclinic, established in 2018 among a network of 10 polyclinics, aimed to cater for the healthcare needs of residents within the Potsin region. Despite its significant purpose, the clinic, with a meager bed capacity of 13, grapples with serving a community population exceeding 300,000. The inadequacy of infrastructure has led to the arduous challenge for the dedicated staff operating within the facility. Regrettably, the non-functional surgical theater has further exacerbated the struggles, hindering the clinic from conducting essential surgical procedures. Additionally, the absence of a blood bank necessitates reliance on neighboring medical institutions for urgent blood transfusions. Remarkably positioned along the Kaswa-Cape Coast stretch, notorious for a high incidence of accident-related cases, the clinic stands as a vital checkpoint for medical emergencies. Despite the critical role it plays, the lack of resources has rendered its effectiveness limited, affecting the lives of residents it aims to serve. Citi News captures the voices of several Potsin inhabitants, shedding light on the distressing repercussions of the clinic's shortcomings on their lives.
The challenges they are facing, mostly equipment and also the road leading to the polyclinic. Most of the time, this road, the main road here, is accident-prone zone, and so there are a lot of accidents that happen. But when accidents occur, instead of them to bring the patients to the hospital, they send them far away to Winneba. Some of them will die on the way, just because the road is not good, so they can't bring them here. And so these are some of the challenges we are facing as a people, and the environment is also small. I think it needs to be expanded, because the hospital is just opposite, directly opposite to the Potsin Media Senior High School. A lot of students, when they get affected or any infection, they go there. Sometimes you'll be a patient, you'll be there, and then a whole lot of queue, a lot of people there, and you cannot have your hospitalization so very easily. So I suggest that it's a government hospital. For that matter, government should look at it.
I happen to be a teacher in the secondary school and also a member of the health committee in the secondary school. So anytime we have health challenges, we have to rush the kids to the facility. And sometimes we can carry not less than 10 students in the school bus to the facility. So when we get there, getting bed for the students becomes a challenge. So in terms of logistics, I will say that though the hospital is doing well in terms of health service delivery, in terms of the logistics, they are handicapped in a way. So we appeal to stakeholders, as usual, that they should come to the aid of the facility, in the sense that Potsin is growing. Invariably, it is growing as a bigger community. And for that matter, people that access the facility, that's the Potsin Polyclinic, it is increasing day in, day out. So the challenge is that we don't have enough facility to accommodate the patient that gets in there.
Dr. Jerry Kweku Vlad Nkebe, the committed medical superintendent at the facility, earnestly appeals for the benevolent support of individuals to elevate the standard of the clinic and uplift the quality of healthcare services for the community.
Population of, like I said, hovering over 380,000, and with a bed capacity of 13. When you do the ratio or the numbers, it tells you what it means. So God forbid a mass situation comes calling, we'll be found wanting. So my appeal, or our appeal, and this appeal is not only coming from us here, but it's coming from the community at large, to the stakeholders, to philanthropists, like I said earlier on. If they could grace us with a facelift if they could come and construct some wards for us. We have land, we have spaces. We are very much engaged. We have already a needs assessment form that already prepared. So anybody who comes, we just supply you with it. Even if it's a grain of sand, even if it's a block of sand, a wood that has been chopped, it will all go into the upliftment of this facility so that we can continue to deliver on our mandate, which is universal health coverage for mankind.
This is the Potsin Polyclinic here in the Gomoa East district of the Central Region. This facility was opened sometime in 2018, but until now the facility, which takes care of over 380,000 people within the constituency, lacks a lot of things, ranging from a well-equipped theater to some other things. Medical officers here needs help. Carvis Tete, Citi News, Potsin.